you all. Brenda, Karen, I'm just honored to be here. And I'm going to talk to you about something that is just very important to me, and I'm blessed to be able to have done the work that I'm going to talk about today. This picture, some of you will remember this from Memphis from 2005. A picture of the community gravesite, because there were so many babies dying at that time that they were buried together. And this picture really emphasizes why this work has been born through my efforts with a lot of other people. So first we'll identify the association between breastfeeding and post-perinatal infant mortality in the U.S. and hopefully have some time to talk about the opportunity for breastfeeding promotion, protection, and support in the infant mortality reduction initiatives. So we've seen a lot of maps already today, but this is the U.S. breastfeeding rate map. And at a glance, you can see that the white states are the lowest in breastfeeding initiation, and the dark states in our northwest area, the highest breastfeeding initiation. And I do want to point out, I think Brenda mentioned Tennessee changing colors. So Tennessee is not in the lowest breastfeeding rate. So yay. Now, the CDC measures breastfeeding through a survey known as the National Immunization Survey at different time periods, and this is the most recent data from the 2023 survey. And so at different points, you can see any breastfeeding, 6 months, 12 months, exclusive at 3 months and 6 months. And this particular slide divides it up by race, ethnicity. And I'm sorry I can't point to both sides at once, but if you look, purple is our Black. Breastfeeding rates are lowest at each time point, and our non-Hispanic Asian are highest at each time point. So we've talked a lot about disparities already today, and they exist in breastfeeding as well. This is the most recent data for Tennessee, divided into those same NIS categories. And I want you to look at this. This is very cool because blue is Tennessee, the yellow is the gap between U.S. and Tennessee, and then the stars are where we've met the Healthy People 2020 goals, which now is a few years past. But look at that, Tennessee is almost up to the U.S. in all these various time points where we're monitoring breastfeeding. The purple is where they've stretched us for 2030 goals. So we all, U.S. and Tennessee, we all have to keep trying. So another round of applause for Tennessee there. And so because I have been around a long time, as Karen mentioned, as an old and mature person, this was a slide I found from an old slide deck from ago. So you see how far you've come. You see the gap with the red. Tennessee in blue and red is the U.S. So now that gap is almost gone. So one more round of applause for you. The CDC does a lot of wonderful things for us, but one is the MPINC survey, the Maternity Care Practices Survey, and Tennessee's most recent score was 72 compared to the 81 of the nation. That's also a climb. That means all your hospitals, all of you are working to improve maternity care practices. The USBC does a statewide report as well, and this compares WIC and overall national WIC and then Tennessee WIC. So we still have some improvements we can make here that overall fully breastfeeding Tennessee WIC recipients are at 8.7% to 12.1% nationally. And then, but this might be another clapping one for the landscape of breastfeeding support, because we know it takes a village for breastfeeding to happen, is that last column you see the childhood, the ECE, Caring for Our Children standard in our early child care settings. Tennessee has a score, and it's 70, so 70 out of 100, and a lot of states have nothing. So just one more clapping for Tennessee. This is probably one of my favorite maps of all time about breastfeeding that our CDC has done for us. And this is based not on the NIS data, but on the birth certificate data. So it's down to county level. So you can just, at a glance, you can see that purple swath from the Delta up through Appalachia. And then the Northwest, which is always so good, is all white. So in this case, dark is lowest breastfeeding. And California, Michigan are not colored, and we'll talk about that in a minute. So I wanted to zoom in for you on Tennessee here by county. And so I loved everybody standing up this morning saying which part of Tennessee you're from. So you can see whether your county is dark with lowest breastfeeding initiation or white with 89% or more breastfeeding initiation. So Tennessee covers the gamut, doesn't it? I mean, all of you, for wherever you're from, are covering a lot of differences in your breastfeeding families. Okay, we're going to switch to infant mortality. Infant mortality is defined as the death of a child before its first birthday. The infant mortality rate is defined as deaths per 1,000 live births, and it's really an indication of a nation's overall well-being. And the U.S. infant mortality rate is higher than other high-income countries, and we have disparities. So the little red arrow shows the U.S., and you can see how many other countries have better infant mortality than we do. And just globally, we know that infant mortality is a huge problem, but this is to be a little bit positive to say even globally over time, this goes from 1990 to 2020, we are seeing a decrease. Globally, they measure under 5 mortality and neonatal mortality separately, but you can see both the rates and the actual numbers of deaths are decreasing globally, so that is something to be thankful for. In the U.S., we have 5.44 deaths per 1,000 live births, and our goal is 5.0 deaths per 1,000 live births for 2030. I would suggest we want that much, much lower. The leading causes: congenital malformations, short gestation, maternal complications of pregnancy, which we've sure talked about a lot today, sudden infant death syndrome, and unintentional injuries. And when you look at the great CDC map, again, you can see those dark states now are the highest infant mortality states, whereas the light color is the lowest infant mortality states. You kind of seen the picture of that swath in the middle of the U.S. down into the southeast with high infant mortality and low in the northwest. And this trend map is so important for us to think about that it goes all the way back to 1915. So we're looking at all races, white and black, and then the black-white ratio is what you see climbing. So thankfully, over time, we're seeing so much less infant mortality, but that black-white ratio you see was very low in the early part of the 1900s, but it's climbing. So as we've already talked about some today, over 2 times the incidence of infant mortality for our black babies, which is just not acceptable. And I want the curves to go together like we saw in the last talk, where there is no difference, right? If you stratify by race and ethnicity, we see our non-Hispanic black infant mortality at 10.6, and the lowest is in our non-Hispanic Asian at 3.7. So this was a really interesting trends map put out by the CDC, and you can see the Delta and Appalachia over time is also decreasing, but you can see that disparity from Delta and Appalachia compared to the rest of the United States. And Tennessee is, of course, we have Delta and Appalachia, so we're right in the middle of all that. So we have an opportunity to improve, right? And this was the most recent data that I found, although we got a preview of some preliminary data today, this morning, but over time, again, Tennessee is improving with infant mortality from 7.4 in 2017 to 6.2 in 2021. So not up to the U.S., but improving. And breastfeeding and baby-friendly workplaces is on the website of something that's being worked on in Tennessee. And I know a lot of other wonderful breastfeeding improvement opportunities are being worked on. So breastfeeding, we know, is the normative standard for infant feeding. It's associated with a reduced risk, many infections, including otitis media, gastrointestinal, respiratory disease, long-term diabetes, type 1, necrotizing enterocolitis, sudden infant death syndrome, even asthma and childhood obesity. When we think about infant mortality and possible causes, we know there's a 40% reduced risk with any breastfeeding for 2 to 4 months of SIDS. Infant mortality in developing countries, there's a 14-fold increased risk if you have no breastfeeding versus exclusive breastfeeding. And of course, for our tiny babies and necrotizing enterocolitis, we know there's a lower risk with human milk feeding. And then postneonatal mortality in the U.S., the first study on this was a 20% lower risk for postneonatal mortality with any breastfeeding. And we want to talk about this a little bit to start us off. So Dr. Chen on top there with Dr. Rogan wrote this wonderful study in 2004 based on a 1988 survey. So think back, we're talking ago, 1988. This was a survey, so it involved some recall of the mothers on their feeding type. But they looked at postneonatal deaths, excluding those less than 28 days, and congenital anomalies and malignancies. And then the controls were the live born through 1 year, and they looked at breastfeeding ever versus never. They found most of their cases were under 6 months of age. And they found, when adjusting for possible confounders, they found an adjusted odds ratio of 0.8 when they divided Black versus non-Black, 0.7 and 0.8. So a 20% reduction in postneonatal infant mortality with the initiation of any breastfeeding. So fast forward to Memphis, Tennessee, and the picture that we started this with. Over time, we were seeing an inverse relationship in infant mortality and breastfeeding in Shelby County, Tennessee. So the blue line with the triangles is our Black population. So you can see how high the infant mortality rate was back in 2004, and even bumped up to 2006, almost 20 per 1,000 live births, and the huge disparity with white and Black with the orange squares. And so, but it is improving over time. So over time, the time period we're talking about for this study is 2004 to 2014. Then on the right side, you see breastfeeding rates increasing, and you can see a doubling really in our Black breastfeeding rates over this time. So this is some things that were happening, bless you, in Shelby County during that time, and the world and the nation. Just to put it in perspective, a lot of things were happening. The Surgeon General's call to action was in 2011. We started inviting guest speakers from the nation to come to Memphis and talk to us about breastfeeding. We put up billboards, and you can see the little blue boxes where it says TIPQC breastfeeding programs. So we had 2 TIPQC breastfeeding projects during this time period. And this was the first billboard that we had made specifically with a Memphis family to put up in concert with our infant mortality reduction partners. So what we did in this study, we looked at that time period, 2004 to 2014, and we looked at the birth certificate data linked to the infant death certificates. And we excluded less than 500 grams, less than 7 days, congenital anomalies, malignant neoplasms, and we had about 150,000 babies and almost 600 deaths. And we did analysis for every characteristic, both mother and child. And for our outcomes, we looked at infant death before the first birthday, over 7 days. We divided into neonatal before the first 28 days and post-neonatal after 28 days. And again, looked at breastfeeding ever versus never, and adjusted for potential confounders that might be associated with both the exposure and the outcome. And these are some of those factors that we looked at here. Excuse me. And overall, our cohort had a breastfeeding rate, our demographics had a 59.1% black in our cohort and 37% white. Most had a high school education. A majority were in poverty, a majority unmarried, very few smoking. We talked about that today, and about a third cesarean section. And the breastfeeding rate of that cohort was 59.6%, so very different than some of the statistics we've talked about already today for the state of Tennessee, but a real big disparity, white and black, for both the live babies and the overall infant deaths. And what we found was very similar to Dr. Chen and Rogan, a 19% reduced risk when we controlled for all those possible confounders with an adjusted odds ratio of 0.81. And when we divided out neonatal or late neonatal mortality and postneonatal mortality, we had a higher effect size in that neonatal period of 50%. Our causes of death in our cohort, which were a small number overall of deaths, were significant for infection. We had a significant reduced risk of 0.49 for infection in our cohort. So this led us to this wonderful connection with CDC because they were watching what we were doing, and that's kind of a cool thing. And they said, let's do this for the whole nation. Let's do it like you did it. And we kept Dr. Chen. I forgot to mention he helped us with our Memphis study as well. And so we got to work with CDC, which was really an honor of a lifetime. So we looked at the national vital statistics data. Again, the census of all live births and deaths. And by 2016, all 50 states had adopted that birth certificate that Tennessee had adopted back in 2004. But finally, all the states had adopted it. And it includes the question, is the infant being breastfed at discharge with a yes or no answer? So we looked at the 2017 cohort, but then we followed them for a whole year after, so through 2018. And so almost 4 million births and 22,000 deaths. But we then excluded, similar to the Memphis study, 500 grams, less than 7 days, malignant neoplasm, congenital anomalies. And I told you California and Michigan were not reporting their breastfeeding rates to CDC, so we were not able to include them. So our deaths, when we made those exclusions, were about 7,000 post-perinatal deaths divided into late neonatal and post-neonatal. And interestingly, for the breastfeeding at discharge, this is determined by a review of the medical records. So even though it says breastfeeding at discharge, if there has been a receipt of any breast milk between delivery and hospital discharge, it's counted as yes. So even if it was just in the very, very beginning, it's counted as yes. And it's important to note, for all of these studies, we're not looking at exclusivity or duration, which we know makes a big difference. We had many covariates we looked at for this study as well. And for the demographics on this, it reflected the nation. We had 20% Hispanic, 54% non-Hispanic white, and 15% non-Hispanic black, 5% Asian. Most of the mothers did have prenatal care. Most were non-smoking. We do have a lot of obesity and overweight in our country, which we know, and we're still having cesarean of 32% and around 10% in ICU or preterm in this set. Now, think about the previous study. By now, we're 83.6% as a nation initiation of breastfeeding over time. The adjusted odds ratio overall of this cohort for 1 year was 0.74, so a reduction by 26% of any breastfeeding. Okay, so for our causes of death in this big cohort, we had infection and sudden unexpected infant death were significant, and unknown and necrotizing enterocolitis were significant, and other. So for this study, we had birth and death linked data for over 3 million infants with a 26% reduction in post-perinatal death. And what I couldn't show you on that previous slide was that the late neonatal death was 40% reduction and 19% in the post-neonatal death. So again, very similar to the previous studies, and even larger and more compelling because of the number of babies. So this brings us to our final study that we just completed, and we wanted to do this because we did it by state and region over 3 years so that we could go to help people go to their state governments. We've talked about that a lot today. Who are the decision makers? To talk about the association between breastfeeding and infant mortality. So this time we had almost 10 million infants born between 2016 and 2018, followed for 1 year. We used the same exclusions as previously and same exposure. And then the difference in the outcome, we looked at post-perinatal death, 7 to 364 days, and then early post-perinatal death for that first half of the year of life, because we saw in Dr. Chen's study that most of the deaths do occur in the first 6 months. And again, this similar covariates we looked at. And again, the demographics were similar to our nation as a whole. And when you pull out the post-perinatal infant mortality for Black versus white, again, you see that over 2 times increase in the non-Hispanic Black babies. This is just a snapshot of the characteristics, and I just love to look at these numbers, but we won't do that today. But just in every category, whether you're looking at age, education, race, ethnicity, you will find that there is higher breastfeeding if you have higher education, if you're a little bit older, and similarly, less breastfeeding if you have an infant who dies. So here's the Tennessee data for that analysis, and we had about almost 250,000 babies and 766 deaths divided into the early and late and full year of life, and 80.5% breastfeeding. And this is what, when I first started working with TIPQC, you might call the money chart, only it's not a P chart, is it? But this is looking at all the states and all the regions, and what you can see are the adjusted odds ratio after we've adjusted for all the confounders. And so the dotted line is 1. So anything to the left of the dotted line is a protective effect of the initiation of any breastfeeding. So you can see just at a glance, almost all our states and regions are to the left. Very few cross over even with the confidence interval, and those that did cross had very low infant deaths and high, large confidence interval. If you look just by region, all of our US regions had a reduced risk of infant mortality with any breastfeeding, and you can see the least amount of reduced risk, if you will, is in the Southeast, but a very, very tight confidence interval there. And so when we look at it by state, Tennessee comes out to be 0.79 or 21% reduced risk overall with the initiation of any breastfeeding, and 0.84 with, for the early infancy death. And this just shows how Tennessee fits in with the other states in the Southeast region for the full year and for the early deaths as well. So in summary, 10 million live births, 20,000 post-perinatal deaths, 48 states, District of Columbia. The overall for that large cohort was 0.67 or 33% reduction. 7 U.S. geographic regions had significant reductions with variation depending on the region. So we got to keep doing more research. Perinatal deaths were not included in the study, so that we were attempting to reduce the possibility of reverse causality. We don't have California and Michigan. We weren't looking at exclusivity, duration, and intensity of breastfeeding, which we know makes a huge difference. And we're not able to look at the causal pathway, which may include racism and other social determinants of health that aren't available on the birth certificate data that we had to look at. So this is the summary of all those studies. So you can see that in the red box that even back in the 1988 case control study, and through the Shelby County study and the 2 CDC studies, we have this persistent reduction in the association of infant mortality with any breastfeeding. In the most recent large cohort, 0.67, a 33% reduction. So breastfeeding saves lives. Breastfeeding promotion, protection, and support are really key to infant mortality reduction initiatives, and eliminating disparities in breastfeeding may help us to reduce those disparities we see in infant mortality, because I really want those lines to converge. And the Lancet series on breastfeeding from 2016 estimated that 823 children's lives less than 5 could be saved if breastfeeding was scaled up to universal levels. These are some of the colleagues on the last two papers, and I put a little blue arrow on Jennifer Comet, who some of you may know from our Shelby County epidemiology department, who helped so much with the Memphis study and the next two CDC studies. And really, I want to acknowledge all my West Tennessee, Memphis people, because this is what stimulated me to try to investigate this a little bit further. And you all are wonderful, and why we started doing this work. So what can all of us in this room do? What can we do about this? Well, we can join infant mortality efforts in our state. Obviously, we joined TIPQC, and we're all here doing this work in our hospitals and beyond. But in your local communities, you may have a FEMUR group that you can go and sit on as a clinical person and give your feedback on as they review the infant deaths. I put up Cradle Cincinnati is where I am now in Cincinnati. That's our collective impact group that's working on infant mortality, and it's really important for the person who's interested in breastfeeding to take a seat at the table of the people who are working on infant mortality, so that we can all learn together and work together. And of course, working with our public health compadres, and they are how we get our work done with our data right. And then just a little sharing from Cincinnati. We made a little video, Breastfeeding Saves Lives. It seemed to fit with the topic. If you want to snap that and get that QR code, it's just a little bit of an infographic about the importance of breastfeeding. And I wanted to mention Mama Certified has just launched February 29th in Cincinnati, and it seems to be very similar to some of the respectful care that you all have talked about, where they interviewed and did focus groups with Black women to see what they wanted about their birthing hospital. And now all the hospitals are putting their data online for all to see about what they're providing in terms of maternal care and infant care. And so moms can now look and see which hospital they want to go to. And they're planning to add on more about the community to this as well. It's just started, but it sounds like it aligns with some of the work going on here. And I just want to thank Dr. Sketsina and Brenda and all of you for continuing the breastfeeding work with TIPQC, because you saw what happened to your numbers. So you're saving babies' lives with everything you do every day to support breastfeeding. So very delighted about that. And I wanted to give a shout out to the Tennessee Breastfeeding Hotline, because Ohio has a hotline now, but only because Tennessee had a hotline first and we stole from you. And it's called the Appalachia Breastfeeding Network. That's what it's run through. So actually, I think there may be some Tennessee people who called that one too. I'm not sure, but we wouldn't have it without the Tennessee Breastfeeding Hotline. And I want to encourage you all to, if you want more breastfeeding, to consider joining the U.S. Breastfeeding Committee, where there's a lot of information about various things happening in our nation. The sectional breastfeeding, if you're a pediatrician, we have a brand new AAP breastfeeding curriculum that is available to all for free. And the Academy of Breastfeeding Medicine has a multitude of protocols that can help you with your breastfeeding families, your local and state breastfeeding coalitions. I probably am preaching to the choir here, though, because I do think you can make a difference and save lives, but you already are, because you're at TIPQC. And I think we can fix this together. I want this map to look differently, don't you? I don't want to have the blue spot in the Delta and Appalachian regions. And I think if we all work together, we can. We can close the gap, and we have to have breastfeeding support for all. So this is the 2024 theme for World Breastfeeding Week, which is the first week of August. And I really love this, and you all have already talked about how we need to support the mothers and the families. And so I really love this infographic because we really are holding them all up. And we have to all do it together. And breastfeeding is a universal solution that levels the playing field, giving everyone a fair start in life. It can prevent malnutrition in all its forms. It can ensure food security even in times of crisis. It can break the cycle of poverty. And in the world we live in, filled with inequality, crises, and poverty, breastfeeding is the foundation of lifelong good health for babies and mothers. And that's all I have. Thank you, guys.